Good morning, it's Dr. Toker, your friendly neighborhood colorectal surgeon, here with yet another emergency broadcast. And some of you may know this, but I have not seen any news on this particular topic, so I thought I would bring it up because it directly impacts my patients. So this is a note to my personal patients, but it impacts all of America. Many of you may not realize that the way we source medical supplies, particularly sterile medical supplies, is quite limited. It's extremely difficult to make these things. You need special equipment, you need special warehousing, and so a lot of manufacturing companies for sterile supplies and drug companies will combine their resources and do everything in sort of like one location, which from a business stance totally makes sense. However, from a national security stance, our national health, that is not the safest option. And I'll give you a little bit backstory before I break into this, but 10 years ago we had a hurricane that hit Puerto Rico, and all of the IV fluids in America basically were being manufactured in this Puerto Rican sterile facility. And so it was taken offline for several months, which caused a lot of chaos. We had to conserve IV fluids. There were cases that we could not do. Certain things that administrators changed about the practice of medicine that are not necessarily the medical standard of care, but that's what we did. And certain cases were canceled if we thought we couldn't do the new conservation methods in a safe fashion. All right, well, you would think we'd learned something. They did move that factory. They moved it to North Carolina, Asheville to be specific, which means, once again, the one location of service where we get sterile IV fluids has been destroyed. And so now we're trying to cobble together a completely different supply chain, manufacturers that can't make as much, taking the existing stockpile, making it last, and the amount of unmitigated destruction that occurred in Asheville to this factory means it will be offline for 6 months. Now, what this tells me is that we didn't really learn anything from the Puerto Rican event. Why put all your eggs in one basket? I don't understand. This is obviously not a conversation that we should be having now. We should have kind of been having a national conversation about this 8 years ago, and we didn't. During COVID, when there wasn't a supply chain that could get us medicines, that unroofed, for me in particular, holy cow, that's not safe for us. Most antibiotics are made in other countries. Now, America does the research and development for these medications, and then they make them in other nations. And honestly, that is a sincere threat to our health as a nation. Anyway, not much I can do from it from my couch in my office. However, to tell my patients, we are still doing surgeries. The biggest impact to my practice is probably how we manage colonoscopies, and that usually when someone comes in for a colonoscopy, we will hang a liter of IV fluids. Why? Because that patient has done a bowel prep. I've been keeping patients on an empty stomach for 5 hours prior to the procedure for safety reasons. Research shows you can actually keep someone on an empty stomach for only 2 hours with the same safety level. I don't trust patients, so I've always doubled that number. So when the hospital calls you, they will probably tell you it's okay to have liquids 2.5, 3 hours prior to the procedure. Make sure you are hydrated, because we're no longer hanging the liter of IV fluids. Now, these are short procedures. They take about 30 minutes. They don't involve any hemodynamic instability. You'll be tolerating a diet immediately when you wake up. So this is not an unsafe practice, but it is the one practice that has changed about what I am doing in response to the IV shortage. If you are having a procedure, please ask your doctors, the hospital, the surgery center, how they are managing this IV fluid shortage. If you're not happy with their answer, then postpone until IV fluids are more readily available. But I will tell you, it's a 6-month process. If you have a serious medical issue, do not let this shortage keep you from having your procedure. But if you're having a completely elective procedure, plastic surgery, or something of this effect, you may want to wait, because your surgery can wait. There is a shortage. And again, I wouldn't want someone having a medical emergency due to the lack of IV fluids, because we're not doing things wisely. And then when all this is done in 6 months, can we just as a nation agree? Manufacturing for these things needs to occur not only in our nation, but in multiple points of service, simply so that there is not this sort of vulnerability again in the future. Anyway, all right, that's our emergency broadcast. We'll see you guys next time.